Welcome to the Am I Mental podcast, the Doctors in Court edition. My name is Sabine Fonderson, a general practitioner. This is case number 5, the case of the doctor handing out sick notes for a holiday. On November 2003, a female patient, which I will call Rachel D., attended the practice of a doctor I will call Dr. S moving forward. At the time, Rachel D. worked as an undercover journalist and was posing as a patient who needed a sickness certificate. During the consultation, which I will break down a little bit more later on, she wanted to take time off work, in particular over the Christmas holiday, but needed a sick note to hand over to her employer. Dr. S advised Rachel D. to come back about a week before her intended sick leave and had been heard stating, "When do you want that actually?" To which Rachel D. replied, "I want to get it to make sure that I have the week of Christmas off." Dr. S then responded, "You must come at that time, then I'll give it to you at that time. I can't do it now." Did I mention that as an undercover journalist, Rachel D. taped the entire conversation? While it is hard to hear at times, the full manuscript was given to the judges during the court case. Let us stop and pause here to dissect the meaning of the certificate. According to the Cambridge Dictionary, a medical certificate is a document signed by a doctor that proves that someone is in good health or healthy enough to do a particular type of work. And a sickness certificate is a document signed by a doctor that proves that someone is not in good health or not healthy enough to do a particular type of work. Simple enough definition, right? Let us go back to the case. Rachel D. needed time off work. She wanted time off during Christmas, but saw Dr. S. in November of 2003. About 4 weeks before she wanted the certificate, what would prove? Simple enough definition, right? Let us get back to the case. Rachel D. needed time off work. She wanted time off during Christmas, but saw Dr. S. in November of that year. That's about 4 weeks before she wanted a certificate to be given to her. And that certificate would prove she was not healthy enough to do a particular type of work. And in order to get that certificate, she was willing to pay Dr. S. at the time £1,000 for the signed document. Dr. S made the following suggestions. We've got to give a medical reason. It can be stress or depression, whatever you feel like. Rachel D. remarked during the consultation, "Is there any way I could get a note with that to guarantee that I've definitely got the time? I just really want to get the time off." Dr. S responded, "We can do it at Christmas, but not now. I can't give it today. I can guarantee that I can give it to you at that time, not that much time in advance." And for £1,000, Dr. S could not provide her with a certificate right at that minute, but she would have to come around Christmas. Rachel D kept insisting on getting the note, telling Dr. S that it was really something she needed because she wanted a holiday. And Dr. S said, "You should not tell me. If you tell me, it's because you want a holiday. I perhaps won't be able to do it. The best thing is to take it easy and let me know at that time, and we can issue a certificate. A patient can come to me and tell me, 'Look, I'm having this problem and I want a sick note.' And the patient might be going on holiday or whatever he was going to do. It's not my concern." Okay, let us stop here again. According to the Society of Human Resources Management, sick leave and the abuse of it by employees usually happen before or after holidays. It happens when an employee, like our pretend patient Rachel D., uses up all other paid time off, has dropped in performance, or missed deadlines. And in many organizations, employees regularly use a sick note from a doctor to prevent from getting fired. But how did doctors get involved in this anyway? According to website newrepublican.com, during the 19th century industrialization, many American companies employed on-site physicians with dual roles. So they were both medics and human resource managers. And in both cases, they ultimately served the corporate interests. Much has changed and evolved since then, which I won't get into now. But through the Much has evolved since then, which I won't get into now. But through union work, employees have gained more rights and are allowed from anywhere between 48 hours to 7 days, depending on the country, of sick days without needing a doctor's note. And over the years, the rise in sick notes have been spectacular and adds even more time to a doctor's work, especially general practitioners who are extremely busy during the day. And certain general practices actually refuse to issue sick notes certificates for their own patients because it interferes with the time available for those who need medical attention. Hence, that's the reason why employers are assessed by occupational doctors or occupational organizations to make this legal assessment and to prioritize who needs a sick note at what time. But what did Dr. S do that handed him? Hence, this is why employees are assessed by occupational doctors in order to make this assessment. But what did Dr. S actually do that handed him? Hence, this is why employees are assessed by occupational doctors. But what did Dr. S do that landed him in court? As a medical doctor, if he felt equipped and knowledgeable to certify a sick note, that he can do. There's nothing illegal about what he did. However, one can pass judgment on his moral and ethical motivations. Number one, he guaranteed Rachel D. a sick certificate a couple of days before she needed it, even though she was not or may not be ill at that time. And the transcript read, "So, at the moment you're feeling stressed about work, is it?" That's what Dr. S said, to which Rachel D. replied, "Yes, well, not so much at the moment." And Dr. S said, "I can assure you that if you still have the problem, then I can give you the certificate." No problem. He basically, at the time of consulting Rachel D., started to plant a seed that at the moment she was coming to see him, she was feeling stressed about work. Now, Rachel D., remember, she's an undercover journalist, said, "Yes, well, not so much at the moment." And then he said, "I can assure you that if you still have the problem, i.e. the stress problem, then I can give you the certificate. No problem." What's the second issue here? He was influenced by the offer of money. He was going to be paid £1,000 for that sickness certificate. During the consultation, as what Rachel D. stated in the transcript, "Okay, then I'll pay at that time. Do you want me to pay today for the consultation?" And Dr. S replied, "Yes, for the consultation." Now, according to the British Medical Association, or the BMA, doctors are required to Now, according to the British Medical Association, the BMA, doctors are required to give out a fit note to their patients for free. And I emphasize their patients, so the patient that they are taking care of or have a patient-doctor relationship or agreement contract. But for private GPs, they can set a fee. And here are some things a doctor who wants to issue a sick note and a fee should consider. A. How much time is reasonably required to perform these professional obligations? It's a clinical work. The consultation it completes needs a completion of a report, and the income you would forego if you're providing this service. According to the British Medical Association, the BMA, doctors are required to give a fit note to their patients for free. And I emphasize here their patients, so patients that they are seeing in the clinic who are registered under their care. But in the case of private GPs, they can set a fee, and here are some things a doctor who wants to issue a sick note should consider. Number 1, how much time is reasonably required to perform this professional obligation? It's a clinical work and the consultation takes time, so there they can set a fee. And they can also consider the income they would forego if they were providing that service. Unfortunately, Dr. S ended up in court, and what did the judges think of that? Well, I'll let you think about it. What would you do in this case if you were a judge? Would you hand Dr. S a warning? Would you strike him from the registration? And if you ever written a sick note, do you want to talk about that, and what was the reason? I've written a sick note as a private GP for other patients, and it's something that I did also for a fee, but it was for a consultation fee and nowhere near £1,000. If you like this podcast, please follow and hit the notification button to be alerted for new podcasts. I also would really appreciate your feedback, and you can leave a voice message and I'll respond. Thank you very much.